Hi, I'm Kat Garcia, licensed professional counselor, and
I'm Dr. Emerald, Doctor of Chiropractic.
we are Painting Wellness. Welcome, welcome. Today we are going to talk about attention deficit disorder, and it is very, very popular topic for many reasons. So ADD. And how this is sort of kind of what it is, and how you can notice or not notice what they are, and maybe some tips on how to manage this as you're experiencing it. So
yeah, I would agree. This is definitely one of those things that I keep hearing more and more about, or people are coming to me and saying, oh, I just got diagnosed with ADD, or I think I have ADD. So it just continues to be one of those things that is in kind of the ether of conversation, we'll say.
Absolutely. And I think it's very interesting because for as much conversation as there is about ADD, also known as ADHD, the H standing for hyper, so that's a different kind, but there's a lot of people that really don't understand what it entails, and I get so many questions like, wow, that's ADD, or a lot of struggles that people have because they either don't know they're diagnosed with it, or they have a partner or a child that is diagnosed with it, or even a peer, like a coworker or a subordinate, and they don't know what it entails. And so it becomes kind of like the sticking point, because it comes with a lot of sort of prejudice on their behavior because they don't understand what ADD is. So, do you know people that have ADD or are diagnosed with ADD?
I don't know how many I know are or are not diagnosed, but there are some people that I would say they would categorize themselves, or they would identify as someone with ADD or ADHD.
Okay.
Yeah.
So when you think about ADD, what sort of kind of definition do you give that? Like, what do you think ADD is?
So for ADD, I would think of someone that is kind of hopping to different topics, or not able to really sit down on one project for long periods of time until there is something that really catches their attention. I think of it as like maybe an elephant, where they're slow to get that momentum, but then once they're there, it can be hard to stop them on that at times.
Okay. That's a very interesting analogy.
Well, thanks. So, it works for my brain. Also, like needing to move a lot, having a lot of energy that they're not always sure where to place throughout their day.
Yeah. Those are some really good examples. So with ADD, I want you to think, our brain is our control center, right? And we've talked about this before. And so when in the brain of those that have ADD or ADHD, and we're going to talk about the difference in a second, our brain is almost like it doesn't manage certain parts the same way that a typical non-ADD person would manage. And so I say typical because when we're talking about neurological, you can either be neurotypical, right, or you could be neurodiverse. And for those of us that have ADD or ADHD, we consider ourselves neurodiverse, right, or neurodivergent, right? And so it's really important that you understand that ADD is not necessarily always hyperactive. So there's a lot of individuals that have ADD that do not show signs of hyperactivity. That's why there's ADD and then ADHD. But it's almost like I want to call it like almost like a misfire of certain areas, like impulse. Okay, and impulse does not mean hyperactivity. It can be a lot of things. So what do you associate, like when somebody says ADD? Like, do you have specific behaviors of the people that you know that identify themselves as ADD that you're like, oh yeah, or you see somebody, you're like, they must be ADD?
Yeah, well, I'm trying to think now, because like I feel a lot of people seem to at times be fluid between what they would say that when they're ADD and ADHD. So I'm trying to separate that piece out, and I'll be one of the first to say, like, this isn't my like strong suit of knowing all of these different things. But for the ADD person, I mean, a lot of times it is having a hard time really working with that impulse control and being able to like maybe track all of the different things that are going on in their brain. And so it's kind of the shiny object syndrome at time where they're like, oh, this is really exciting, and they get really excited, and then it can maybe lose that momentum, and then they're ready to move to the next thing.
Yeah, I get that. So I many adults go their entire life without being diagnosed that they have ADD, and it's very interesting because we find now that there are so many children diagnosed with ADD or ADHD. And I know that one of the things that you had mentioned to me as we were talking about ADD pre-recording was but that term has been used a lot for to make excuses for behavior. And what does, I mean, how do you really differentiate those things? And that is absolutely true. And I think, I remember one time having a conversation with somebody, and they said, well, it's incredible because this person was in their 50s and said, well, when I was young, nobody had ADD. And you would get spanked, or you would be told, or whatever. And I said, well, and those are the people that now struggle with many things, including OCD, because they weren't able to stay focused, so they had to develop maladaptive coping skills. And the reality is that when we know more and we know better, we can diagnose people and help them. But a lot of times, these kids that were maybe undiagnosed 25 years ago, were kids that maybe were having problems academically, or having IEP, or guess what? Behavior issues.
So IEP?
Individualized education plans. So it's like when the kiddos have specific things at school that the teachers are they have accommodations. Okay. So that's one of the things that I always say is yes, can we have people that use it as an excuse? Absolutely. Are there people that are simply distracted and don't have ADD? Absolutely. But we're going to sort of make sure that if you're having symptoms of this, that you should talk to a provider and make sure that you get assessed, especially, and this is really important, if it's impairing your functioning. Okay? I know a lot of people that have adults that have not been diagnosed with ADD or neurodivergency, right? And they have developed type A personalities, so to speak. Oh, they're really, they need to be perfect, or, they're obsessive about these things. Well, a lot of times what happens is when you cannot focus and you struggle with that, you start creating ways to actually maintain your focus. And so it can become compulsive and obsessive. And so again, not everybody, we're generalizing, but that is one of the things that a lot of adults have struggled with all their life, and they found these maladaptive coping skills that now they're dealing with, well, I'm a perfectionist, or everything has to be just so, or I'm not going to fail, which we've talked about narratives before in the past. And so this is how it can be created.
So when we're going through and we're trying to determine how do I even have this conversation with my provider if I am thinking that maybe this is a possibility that I'm my brain is functioning in this way, what are some of those things that we can look to be ooh, these are just some flags, we'll say, there'll be yellow flags that we can be oh yeah, maybe there are enough of these, I'm going to collect them and I'm going to talk to my provider about.
Yeah, absolutely. So one of the big things, and there are studies about this, how sometimes attention deficit or ADD, ADHD can be correlated to poor behavior in children. So they can't sit still, right? At school, they may blurt out answers without raising their hand. They might stand up in the middle of the class. that kind of impulsive behavior. Now, I've also seen adults that have those types of impulsive behaviors, that they cannot sit still.
Yeah.
And that they actually blurt out things during conversations. So that is a very, like a telltale sign. If you have, just know that that does not mean that is a bad behavior, that a kid is having bad behavior. They may actually be experiencing like that lack of impulse control.
Can I, maybe, I'm going to ask it, not maybe, I'm going to ask a question around this and maybe push back a little.
Sure.
I'm just like, my question around that is like, with kids, like, they need motion. That's really,
Absolutely.
that is a really, really important part of brain development. And when I guess I don't know how long kids are actually sitting in their seats throughout the day, but I imagine it's quite a bit. And many adults have a really hard time similarly so I'm like, well, if adults struggle to do this, we're expecting a lot from kids.
Absolutely.
That as they're developing, that's a really important thing. And again, not a parent, I don't have a kid in school, but it also feels like this narrative of like decreasing of physical activity throughout their school day, less recesses.
Absolutely.
So are we trying to adapt the kids into this mold that we're creating? And it's hard to do
absolutely.
that.
And I think, and that's where we have to say, we're going to, like you said, collect all these little behaviors and see if there's a bigger picture associated to it. Obviously, kids need movement. Adults need movement. If you are an adult and you sit all day, you might want to stand. You might want to, there's the standing desks. Like so we're talking about repetitive behaviors that cannot be corrected for children, that they're struggling with. And for adults is behaviors that they literally, like, they're going to crawl out of their skin. So with adults, we get to move whenever we want. So if all of a sudden you just are randomly standing up in the middle of conferences, or you're feeling like you're crawling out of your skin, and you've increased your activity, it's not that you're, you have a medical problem with circulation or things like that. So it's things that it's an accumulation of things. So all these symptoms that we're going to talk about independently are not necessarily indicators of a neurodivergent diagnosis. However, a collection of them are. So that's a really great thing to note.
And I think that's important, because it's, even though you just said it before you were going into this one example or this one flag, is that we have to collect all of these. And probably a bias of opinion, I feel like that's one of the big flags for kids to be diagnosed, or at least in the past, we'll say. I don't know what, but that was my feeling, was like, oh, they can't sit still, or they like are active during class. I'm like, well, yeah, they're kids. Like,
and there's always that age appropriateness, right? One of the other thing is like one of the things that I help a lot of parents parent or work with children that have neurodivergency. And one of the biggest problems that I see is that we might have a parent that understands the diagnosis and one that doesn't. And a lot of, not only children, but adults also that have ADD are perceived to be lazy, or disrespectful. He's not listening, she's not listening, she doesn't do her chores, you have to tell her several times. Again, normal, we have to repeat for kids. But we have to also note that people that have ADD require a different kind of follow-up. They require a little more prompting, because they'll be looking at you and they might forget. They're not listening. And so if you have somebody that is diagnosed with ADD and you see them doing that, please know that that is not that they're being disrespectful and they're not being lazy. You have to do that. And the more prompting, and I do tell parents that have children that with ADD, when you tell your kid to pick up their room, that works for a neurotypical child. And sometimes, but it definitely does not work for a neurodiverse child, because there's a lot of things going on in that brain. My clients always laugh because I say, neurotypical people have, ducks and they're in a row. Maybe a pigeon in there sometimes, but we have squirrels and they're in a rave, and we have lots of things going on in our head. And so it's trying to figure out I've had people even explain it as buzzing in their head because there's so much going on. So we want to make sure that, again, we're collecting all these pieces, all these symptoms, and that it's not just individual things, right? We also have to take into account age appropriateness, levels of activity, all those things. But keep tally. What are some of the things that you're trying to correct that your child is really, really struggling with? What are some of the things that you as an adult see in your partner and yourself that they're really struggling with, even though they can't, they're not noticing perhaps, or maybe they do. One of the biggest things for adults is procrastination. Okay. So a lot of people say, well, I work better under pressure. And that's okay. But there are, can be one of the symptoms of ADD. It's that procrastinating because they work better rushed because their brain can focus because it's a short amount of time that they have to do it. Okay. Which, it's really hard because it can cause a lot of problems for adults at work, right? Or even in relationships, right? Forgetfulness. I'm not talking necessarily just this. I walked into the room and I have no idea what I'm doing in there. That happens to a lot of us. It's an anxiety thing, or simply a distraction thing. But if it's happening all the time, forgetfulness about conversations, forgetfulness that they asked the question like 2 minutes ago, right? Forgetfulness of I'm doing this task, and this task, I picked something up and I went to the kitchen and I started this other task and I never finished what I started. That I see a lot. Again, individually it might not be a big thing. Yeah. But if you're seeing it with all the other symptoms, that can be something that we need to pay attention to.
And I like that you keep emphasizing that it's together. This is the thing, because as we've discussed in different episodes, and then even in this one, when we're talking about, well, physical health, mental health, emotional health, it's a Venn diagram, but it is Venn diagram on Venn diagram of like all of these different things. And so there's a lot of overlap.
Correct.
And so you can have similar, quote unquote, symptoms that could mean multiple different things. And so we really have to take a step back and look at the whole picture.
Yeah. One other, and to that effect, one thing that we find that there are studies on is how some children may appear depressed. And it's actually a sign of ADD because they are not being maybe successful at home, or they're not being successful at school. They're getting a lot of pressure, so they start becoming very depressed because they can't function how they would like to function. And so that's actually, there's studies on that and how detrimental that can be to children. So I know, for example, my son, before he was diagnosed with ADD, I knew he had ADD, but his providers went through maybe he's depressed. Yeah. And I was like, no, he's got ADD. And we were able to see that once the ADD was treated, the depression part went away because he was able to work at school how he wanted to.
So what does that look like then? Because is there other like big flags that before we transition, is there other big flags that you would say like these are things to look at or consider that you may have ADD before we transition? Because I'm interested now, like when we kind of like know what to look for, how do we start working in the realm that we're wanting to work best? Yeah. If we find this.
So we're going to look at seeming disrespectful or defiant, seeming lazy, forgetfulness, daydreaming, right? Procrastination, having to do things in a certain order. So once they get into a task, they have to do it in a certain order, or they won't do things unless there's a certain order to them. Leaving tasks half undone, just like can't sit still, the fidgeting, the tapping of the feet, tapping of the hands. So there are other quirky things like when you're laying down, lifting your hand up it's like a self-soothing thing. And a lot of people that have ADD do that, and they're laying with their hand up. Okay. Fidgeting with their feet. or like with their toes at night, that is a sign that can be a sign of ADD. So things like that. So if it's fidgeting, if it's that type of thing, and it seems like it's a constant blurting out of answers, talking random information, always needing to associate a conversation with maybe one of their experiences because they're trying to mentally connect to the conversation, that's something that we see a lot. Okay. And there's a lot of symptoms, but those are some.
Those are like the top 20 hits.
Yeah, sort of. Sort of, yeah.
So if we've determined that ourselves or a loved one or our kids have ADD, what are some what are tips then that we can work on for ourselves and with our family members to make this an easier transition?
Yeah. So for those of us that actually have the neurodivergency, some of the tips are, make lists. Please don't be hard on yourself. Know that some things that may work for people that have ADD may not work for you.
Yeah.
I'm a huge fan of color coding, or I'm a huge fan of index cards in colors, because we can color code and our brain can match what's important. So making lists, setting alarms, making sure that you have a quiet place where you can kind of decompress at the end of the day, and making tasks that are really big, break them down into small tasks. That's really important.
So you don't get overwhelmed?
So you don't get overwhelmed.
So there's some celebration and...
Both.
Okay.
Both. So we want to make sure that we are being able to complete the task, or that we are not starting a task and get distracted. We're going to do smaller tasks and complete those, so it's not left half done.
Got it. I'm just imagining, for kids, this has just got to be so hard because everything's on computers.
Oh, yeah.
And so,
I mean, and
just talk about distraction of being able to just stay focused when the squirrels are like, that looks cool.
I know. And I know that we talked about video games or electronics or whatever. And this is sort of one of those things. Is typically we say 10 to 15 minutes a task is, and then a break. And it doesn't mean just stop doing it. It might just be like, you're doing math homework, let's do math homework for 10 minutes, and then let's do science homework for 10 minutes.
Got it.
So we're just redirecting attention.
With that redirection of not only attention, is it physically moving into a different space? Because it sounds like there's a lot of pattern recognition for the brain in these individuals. Is it we do, I don't know, math in this seat, and then we're going to go a couple seats down, or the other side of the table, and we're going to do science?
Maybe, yeah.
I don't know.
And again, it depends.
Yeah.
I've had clients that do both, or either or, and it does make a difference on the person. And that's why I say, no, don't judge yourself if you're trying to figure something out and it just isn't working.
Yeah.
We got to try lots of different things. For those of us that live with somebody with ADD or have a partner with ADD, we love cool pencils and journals. We may not use them, but we love them.
I'd like to look at them.
Yeah, we most definitely. I want people to make sure that they understand what ADD is. Educate yourself, be kind, be understanding, and non-judgmental. Because trust me, the people with ADD are judging themselves much harsher than you can. And if we make fun of the way that they're doing things or things like that, it might be working for them, and then now they're ashamed and they don't want to do it anymore.
Yeah.
So it's kind of it's really hard. Ask questions like, hey, is there something I can do? And a really, really important one that I think doesn't get talked about enough, because I think people might get offended, is don't interrupt. If your partner is in the middle of doing something and they have attention deficit, give them a second to finish what they're doing. Don't interrupt, because it can actually completely derail them. In conversations, if you're talking to your partner and they have ADD and you're interrupting their thought pattern, they may not be able to go back to what they were saying.
I mean, that's just sounds like general advice.
Yes. Yes. But it's so much more so. And then some people are like, no, but tell me, what were you saying? They're like, I don't know.
That's gone.
it's gone. It's gone. So there's a lot of things that that you can do as a parent. A lot of reminders. It goes a lot with, again, things that you can do even if you don't have a partner or a child with ADD.
Yeah.
But I would say for people that have neurodivergent people in their life, just educate yourself. Ask for resources. Ask questions of the person.
Yeah.
And, and I think, and don't shame them. That's a big one.
What I like is, because we're gonna wrap this up in a second, but I think that just because if you're different than others or your brain works differently, yes, it can be harder in some things, but I feel like that it can be also an advantage because your brain works differently, and it means that you perceive and work through. So what are some I don't know, superpowers that these are neuro quote unquote neurotypical people? They're just we can't even compete, I guess, on that.
So with neurodivergency, we can hyperfocus. So when we get into a task, we can just be very hyper-focused and get it done.
Yeah.
Very attention to detail. The other thing is that neurotypical people want to multitask, but they don't do that great.
Yeah.
For ADD people, we can multitask. In fact, it's we'll have a phone and we'll have Netflix and we'll have something, and so typically I say that's terrible, but however, when you have a lot of things happening in your brain, you actually do much better with that. And so being able to understand that the people around you that might be doing that, it's not that they're being disrespectful, it's that kind of thing.
It's almost soothing on some level.
Yeah. And also understand that sometimes because we have so much, our squirrels are, out of control in there, that we might need a lot of quiet space. And so our moods may shift very quickly, like our speeds.
Got it.
But, knowing, hey, if you're neurodivergent, you can hyper-focus and you can do multiple things at once, and it can work in your favor. So.
Yeah. I love that piece, because it feels like, oh man, I maybe I have ADD if you're listening to this, but then it's also but there's some benefits that we just have to spin that perspective too, and not to say that you shouldn't, talk to your provider about this, you should, and then that gives you more resources to better understand how to help things work better for you. Absolutely. I think that's a lot of the conversation here is recognize what's going on, be aware of it, so then we can start applying different techniques, so then you can excel where maybe it's felt like you're just banging your head against the wall because you're I just am struggling in these different scenarios. So to gather things up, closing my eyes, I'm imagining where all the squirrels are and what they've gotten. A lot of impulse behavior could be for symptoms, quote unquote symptoms, needing blurting out, maybe just having your arm up as a soothing technique, a lot of different body motions, maybe some twitching, being able to rather not focus at times on one thing, needing to shift, but then when we're shifting, we lose where we were going with that previous thing. So other big flags that you could think of that I missed on those, we're just kind of
no, those are good. Yeah, for sure.
Those are great ones. And then some tips that we can look at is make lists, color code, to then allow ourselves to categorize the different things that are going on in our brain. I could also think of with that color coding, that's a good anchor point for our brains to help us get back to that point, which is great. If you have a child, 15 minutes on one thing, which I love to, because then you can get up, move around, maybe switch to a different subject, come back, give yourself breaks on that. And then some superpowers that, yes, it can feel like it's hard to get focused on something, but once you do get focused on it, you can become hyper-focused, and you can multitask maybe more easily than other people are able to.
For sure.
Anything else in there?
No, you
boom,
got
boom,
it.
boom,
You got
okay.
it.
Awesome.
And again, this is a conversation that we can go on and on, because there's so many quirky things that are just, they're funny and they impact relationships. But yes, those are really great.
Awesome. Well, thank you everyone for joining us on Painting Wellness. I'm Dr. Emerald, Doctor of Chiropractic.
And I'm Kat Garcia, licensed professional counselor. And make sure to hit that follow if you want to listen to more topics. And you can find us on YouTube and all social medias and streaming, right? The Spotify and iTunes and Prime.
Yes.
Amazon. Yeah. So
Awesome. All right, you guys.
Whoa.
Sorry. Clinky clank.
Clank. You guys, thank you.
Bye.